let's discuss risk factors right now, doctor. We have a graphic, I believe, of risk factors for this procedure. Maybe not as common, but we need to go through them. Can you walk us through these?
Sure. Those are risk factors usually after the surgery. Bile leak occurs in about 1% or less of, usually less of the people. Usually that means sometimes you can have a leak coming straight from the liver. There's different anatomy, and this rarely happens. Sometimes one of the clips that we use to take the gallbladder off its base can leak a little bit. Those are where bile leaks come in. Usually they can be treated. It does take another procedure where our friends, the gastrointestinal doctors, will go ahead and put a little stent in that area. So it's usually managed very well. Bleeding, it does not occur very often. It's usually about 1% or less as well. Blood clots are seen in the post-operative period. And some of those patients are usually, their risks are determined ahead of time. Some people are much more higher risk, patients that don't ambulate, patients that have had clots in the past, things like that. Heart diseases, our friends in primary care do a good job of screening our patients to make sure that there won't be any heart, or at least a very low chance that they'll have a heart complication. Infection, this occurs if the gallbladder is not just inflamed, which most of them are, but are severely infected. Sometimes there can even be pus or a lot of infection inside the gallbladder at the time of its removal, and those people may even require a drain, where we put a little surgical drain in, which we take out 3 to 5 days later. Injury to nearby structures, thank goodness, doesn't happen very often. It's very rare, but we have to always remember as surgeons that the gallbladder anatomy is some of the most variable in the human body, so we have to be very alert for those sort of things. Pancreatitis can occur if any of those stones pass downstream, because where the pancreas empties is also in that common bile duct, or that highway between the liver and the intestines that we discussed earlier, and that can cause pancreatitis, which is unfortunate and can extend a patient's hospitalization. And anybody can get pneumonia if they don't get up and move around.